بسم الله الرحمن الرحيم. laparoscopic pelvic lymphadenectomy. البوزيشن زي ما انت عارف كده اللي هو Trendelenburg position using third degree optical lens under general anesthesia, fully scatter the mast, optical trocar and two working angle 5 to 10 millimeter in the lower quadrant. We will start by lateral pelvic wall. The rules of laparoscopic pelvic lymphadenectomy: you must start firstly in radical hysterectomy by lymphadenectomy, not a hysterectomy. Then from lateral to medial, as you see, lymph node dissection are dissected from three main regions: external iliac lymph node along the external iliac vessels, obturator lymph node along the obturator nerve in the obturator fossa, then and lastly, internal iliac lymph node along the hypogastric artery. Rule number 2 in laparoscopic pelvic lymphadenectomy: you must know that laparoscopic pelvic lymphadenectomy in block, not in pieces. In block, not in pieces. Okay. Incision of the peritoneum along the iliac vessels, then mobilization of the lymphatic tissue using a simple bipolar Maryland. Rule number 4 in laparoscopic pelvic lymphadenectomy, which is very important: the fatty tissue is your friend. Okay, you do a natural deal. You can go through the gray zones, through the peritoneal dissections in a sweeping manner using a simple bipolar and the cold scissors. وانا رايح فين ما انا راجع تاني. انا رايح فين ما انا راجع تاني. اللي ماسكه ده الاي بي ليجامنت زي حضرتك شايف كده، وسكيلتونايزيشنز للاي بي ليجامنت، fundibulopelvic ligament, complete hemostasis, complete skeletonization, then cut using a cold scissor. Yes, very important. Then the iliac vessels. وانا رايح فين؟ انا رايح للgenitofemoral nerve and the boundaries of the psoas muscles. زي ما انت شايف كده انا بفتح الشيس بتاعي using a sweeping manner movement. Then you can dissect the peritoneum اهو in sweeping manner, fatty tissue your friend, as you can see. Then I will go through the lymphatic tissue and lymph node dissection. Dissection of peritoneum along the iliac vessels, as you can see. اهو طبعا الباوندرز from above downward very important. تمام. يبقى تاني dissection of lymphadenectomy: you must from lateral to medial in block, not in pieces. The fatty tissue is your friend from above downward 3 rules is a very important rule. ان انت بتفولو الرولز دي اثناء الشغل with complete hemostasis زي ما حضرتك شايف. خلاص اهو genitofemoral nerve. simple bipolar في ناس بتستخدم ليجا شور، في ناس بتستخدم هارمونيك، في ناس بتستخدم مونوبولر. انا كهمامسي كل الناس عارفين شغلي classic surgeon simple surgeon using a classic bipolar simple bipolar against الادفانس bipolar بصراحة في شغل البلفس. you do a natural D. انت بتدخل واللوز اريولار تيشو على اللوز اريا كونكتيف تيشو بيبدأ ان هو زي ما انت شايف كده بيبدأ يفتح لك اللوز اريا كونكتيف تيشو to dissect. you do a natural D. خلاص اهو لازم implock removal of the lymph node. خلاص removal of the lymph node يا جماعة الخير لازم retrieval of the lymph nodes. لازم النودز are placed in the endobac and extracted via a port site. تمام اهو very important to follow a post-operative and monitor any lymphocene and in any nerve injury at the operator nerve and deep venous VTE assessment. They're very important. This is a malignancy, a radical hysterectomy with lymphadenectomy, major pelvic surgery. So very, very, very important to assess the VTE and to start blood thinners as soon as possible post-operative to prevent thrombosis and to instruct the patient toward the early mobilization post-operative. You are not a surgeon to remove a node. You are a doctor. So VTE assessments with early mobilization to prevent thrombosis and elastic stocking are very mandatory. And to stop any HRT pre-op. Very important also. Okay. اهو implock. Okay, implock dissection. اهو يا سيدي طبعا احنا هناخد البلفيك سبيسز in the next lecture ونبدأ نشتغل في الاناتومي of the pelvis. النهارده قلنا الرولز of pelvic lymphadenectomy. قلنا الأهم من الشغل دايما تظبيط الشغل في 3 رولز اللي أنا قلتهم. خلاص انت بتيجي على الليمف نودية كده انت بتاخدها ان بلوك ولازم هيموستاسيس يا جماعة. انا بشوف ناس بتشتغل بلفيك ليمفاديكتومي مش عارف بحس ان الدنيا بلادي فيلد. احنا مش في بلادي فيلد يعني. اوكي اهو ان بلوك اهو ان بلوك اهو ان بلوك اهو اهو toward the obturator fossa، وده الobturator nerve، وده الobturator lymph node. Very important, the closures to deflate the abdomen and remove the trocar under diversion. Then fascial closure, very important. Any 10 millimeter trocar must be closed by fascial closures. Okay, very important to prevent any port hernia. Retrieval of the lymph node in the endobag and extracted via the port site in the endobag. Okay, very important to monitor and any lymphocyte and any nerve injury like obturator nerve injury post-op, any mobilization to prevent thrombosis, and very important to follow the early enhanced recovery program, nerve to the obturator nerve. Okay, this is the obturator nerve. Thanks so much، واشوفكم ان شاء الله باذن الله في فيديو جديد. باي باي.